Welcome to the PA Insights podcast, powered by NCCPA. Today, we're joined by someone whose career embodies both the depth and heart of specialty medicine, PA Noor Ali. 15 years ago, Noor received a single unexpected phone call that sent her on a path she never anticipated, stepping directly from new grad PA school into one of the most specialized corners of medicine, ocular oncology. In our conversation, she walks us through that journey, the humbling early days, the mentors who shaped her growth, the steep learning curves of a niche discipline, and the powerful impact of collaboration, patient communication, and curiosity-driven learning. She also shares what inspires her after more than a decade in this field and offers thoughtful advice for PAs and students considering subspecialty careers of their own. It's a conversation about growth, resilience, and the profound privilege of caring for patients at some of the most vulnerable moments of their lives. Let's get into it. Very welcome to have on the PA Insights podcast, Noor Ali. Noor, thank you so much for joining us today.
Thank you, Jesse. Glad to be here.
For those unfamiliar, can you start by helping explain to us what the field of ocular oncology encompasses and what specifically drew you to it?
Yes. I'll be glad to share that with you, Jesse. So essentially, ocular oncology is a highly specialized area in the field of ophthalmology focused primarily on tumors that develop within the eye or intraocular tumors, as we call it, namely uveal melanoma, retinoblastoma, lymphoma, and ocular surface tumors such as squamous cell carcinoma or conjunctival melanoma, as well as metastatic disease that spreads to the eye from other parts of the body.
So you mentioned previously in talking that you landed an ophthalmology position almost by chance after PA school. What was that early experience like stepping into such a specialized area with no prior background?
Yeah, so when I started, the technical complexity in ocular oncology was quite rigorous and immersive because of the nature of a cancer diagnosis, as you can imagine, and the sheer volume of patients. So, very early on, I knew my job was fast paced and required a very high level of responsibility. The role involved an extensive amount of learning and mindset to adapt to a new environment, and I was prepared for that. Progressively, I build competence by mastering the fundamentals, understanding the disease processes and the treatment principles. I spent several hours just observing, asking questions, reading, and seeking feedback. Over time, with repeated exposure to complex cases and reflective learning, helped me trust my own judgment. I began to see the impact that I was making on my patients and my team, showing me that I could contribute significantly and meaningfully while continuing to grow as a new grad. So for me, my confidence in ocular oncology came about gradually early on, grounded in preparation, curiosity, and continuous learning. And this is something that I had envisioned as a PA student.
So, were there any mentors or moments that shaped your trajectory early on or made a big impact as you were beginning in this field?
Absolutely. So, mentorship played a critical role early in my career, particularly as I navigated through the complexities of a super specialized field. My attending Dr. Dan Gambas was my very first mentor, and I was fortunate to learn from his expertise in the field and work alongside him. He introduced me to academic medicine, a path that I had not previously considered. So, my early experiences were instrumental in shaping my development in such a niche field.
So, let's transition to talking about a day in a life of ocular oncology. What does a typical day look like for you?
Yeah. So a typical day for me in the clinic starts with chart reviews. I go through patient lists for the day, or reviewing charts. I like to understand the full picture of every patient before I walk into the room, as our patients can have complex ocular and systemic histories. After that, I start seeing patients from everything, starting from new patient to consults, postoperative appointments, and to follow up patients for their ongoing treatments or surveillance. So, throughout the day, I'm doing focused ocular exams, reviewing imaging like optical coherence tomography and fundus photography, and discussing the plan of care with my attending. I also spend a lot of time educating patients and families on the nature of their ophthalmic cancer diagnoses and the impact it could potentially have on their lives. Between visits, I document in patient charts. I answer patient messages, coordinate imaging, schedule surgical procedures, and communicate with multidisciplinary teams, especially if a patient needs systemic workup or other referrals. Towards the end of the day, I see my last few patients, wrap up my charting, make sure all orders are in place and coordination pieces are in place. And I always try to leave the day with everything closed out. So many of my patients and my team have what they need moving forward. And on the days when I am scheduled to be in the operating room, I'm involved in either consenting patients for their scheduled surgical procedures or first assisting during the case, entering postoperative orders, and staying in close communication with the nursing team in the recovery or PACU unit so that the patient can be discharged or admitted um, appropriately as needed.
So, correct me if I'm wrong, you handle both adult and pediatric patients. So, I'm curious, how do you adjust your approach between those two different groups? Because I imagine it's very different.
Yes, you're absolutely right. So meeting each patient where they are, whether it's a pediatric or an adult patient is essential. Taking the time to listen and genuinely understand their needs makes a meaningful difference. And so this tailored, flexible approach allows me to fully be present with my patients and engage in that with them in a way that truly matters.
So, when you're doing this work, you've described it as being dynamic and highly collaborative. How do you coordinate with different individuals like oncologists, pathologists, radiation teams to provide that cohesive care for your patients?
Yeah, so simply stated, effective collaboration is essential. It requires clear, timely, and precise communication among various stakeholders tailored to the specific context of each patient discussion. And this requires a very high level of engagement and a deeper understanding of the various workflows from multiple teams that will ultimately merge for the best interest of the patient.
So, can you walk us through a case or scenario that helps illustrate that complexity and what the PA's role is in ocular oncology?
Certainly. So, one of the cases that comes to mind involved a patient of ours with a very large intraocular melanoma. From the very beginning, the case required careful assessment, reviewing the patient's history, performing a detailed ocular exam in the office, as we normally do, and interpreting diagnostic imaging for our patient. The complexity was not just limited to the malignant or the cancer diagnosis, but in coordinating the safest most effective timeline for the patient. Collaboration was key, and I worked closely with ocular oncologists to review the imaging findings for our patient, coordinated with the radiation oncology team for developing a custom designed eye plaque brachytherapy plan, worked with the operating room for scheduling the surgical procedures, contacted the perioperative evaluation and management team, and social work for the patient's surgical preparedness and risk assessment and with medical oncology team to set up the patient's systemic long-term surveillance. Lastly, I arranged post-op care appointments and medications, making sure that the patient and their family are in agreement and prepared to proceed to the next phase of their care.
So, how do you approach those conversations, especially when it comes to helping patients understand rare or potentially even frightening diagnoses that they may have?
That's a good question, Jesse. So these initial conversations are crucial, and the discussions my physician and I have with patients and their families are based on their diagnosis that could potentially have life-changing consequences. And oftentimes, patients are oblivious to this when they first walk into our office. The best way to approach this is with both transparency and empathy. And we find people when they are in the most vulnerable times of their lives. For some, they have hit their bottom lows. And it's important for me to understand the mindset of my patients and their families and meet them where they are, not just in their physical presence, but emotionally, mentally, and culturally in some cases.
I imagine you also have patients that are traveling really long distances. And how do you and your team help reduce the burden of having to do all of that travel and make sure that they still have access to care when they need it?
Yeah, so logistics can potentially become a fork in the road for some of our patients, especially when they are traveling from a long distance, it's important to recognize which phase of care the patient initially presents to our office. Has the patient been previously treated and is now transferring care to us? Is this a second or, in some cases, even a third opinion? Is this patient willing to seek treatment with us and can they follow up locally elsewhere? And what is their patient preference for seeking care? It's important to recognize these questions and discuss all tangible resources with the patient when they first present. Fortunately, modern medicine is inherently team based, allowing us to draw on a broad network of specialties and resources in medicine, such as psychiatry, social work, case management, and nurse navigators to support both providers and patients through a comprehensive pool of care.
Is there a particular patient story that has really stayed with you over the years that you've been working?
Yeah, so one of my patients once told me that if you don't laugh, you cry. She faced a complex and a difficult course the entire time, yet she showed strength, hope, and resilience. She mentioned to me that I had shared with her to never give up, and so she never did, and she held on to that phrase so tightly. At the time, I was trying to simply support her emotionally and to give her that strength to tap into, not realizing the impact of my own words. So she brought her best self to each appointment with a grateful heart, cherishing the blessings that she had in her life and ultimately returning back to her faith.
That's very beautiful to hear. Beyond your clinical role, you correct me if I'm wrong, all you serve as an APP safety quality officer and change advocate. And I'm curious that what those roles look like on a day-to-day basis and how coaching has shaped your approach to mentorship and team development among your own team.
Yeah. So my role as an advanced practice provider, an APP supervisor, a quality safety officer, and a change advocate may sound formal or administrative. I'm involved in reviewing workflows, monitoring outcomes, and implementing team-based improvements. This helps the team provide consistent, high quality care, but truly, it's about running a highly skilled team that can take on any patient related task in our field and allowing my team to embrace change when needed in a safe place. A team where each member has a clear role to play, understanding that their contributions can have a significant impact on the lives of many. So this impact is not just limited to patient care, but rather it extends to having, an effect on the team dynamics with patient safety, experience, and outcome being a top priority. Briefly, to those who are listening, Coach Rise is a formal leadership coaching program that I had partaken a few years ago that provides an intense and a truly transformational learning experience. And in the world of coaching, we say that the client is in the driver's seat. And oftentimes, my clients do not realize that they are in that hot seat. And once they do, they are able to maneuver through a challenge more swiftly. And Coach Rise has really enabled me to become a coach where I'm able to help my clients and others find solutions through clarity. Oftentimes, life can get a bit blurry. No pun intended. The process of finding clarity can be complex, and I help mentor colleagues and support my team doing just that.
So you've also spoken about the growing role of PAs in subspecialty care. How do you see that evolving in the ocular oncology subsector specifically?
Yeah, so over the past decade or so, the PA role in ocular oncology has expanded significantly, and I can attest to that. PAs have moved from primarily supportive responsibilities to becoming integral members of the clinical team. And there is now greater involvement in diagnostic evaluations, including imaging interpretation that we obtain in the office, and participating more actively in the treatment planning and longitudinal patient management. So we've also seen PAs take on larger roles in care coordination, bridging communication between various teams. Ophthalmology, medical oncology, radiation oncology, and outside specialty care as well. This has improved continuity and access for patients who often require multidisciplinary care. So overall, the role has shifted towards greater autonomy, deeper clinical involvement and a more central presence in patient care and academic contributions within this highly specialized field of oncology.
For students or early career PAs listening to this who are curious about ophthalmology or oncology, do you have any specific advice to give them about what they can expect going into this field?
Surely, first off, I would tell them to not be deterred by how specialized the field might seem at first. No one starts out being a subject matter expert from the very beginning. What matters the most is being curious and willing to learn and being open to asking questions and being comfortable in that space very early on. It is that engagement that matters. In highly specialized fields, the learning curve is quite steep. However, the support from your team is usually just as strong. Nothing is impossible, and I believe that where there is a will, there is a way.
So let's close things out by doing some personal reflections. I'm curious, after all your time in ocular oncology, what continues to inspire you about this work, and how do you personally measure success for not just yourself but your team and your patients?
Yeah, so that's a loaded question. It's hard to put it all in just a few words, but truly looking back, patients need us and look up to us for hope and empathy. And as a healthcare provider, I feel that responsibility and I owe it to them. Being able to walk with them through some of their hardest moments in their lives and still see their strength, trust in you as a provider, and their smiles just really keeps me grounded. Each day is an opportunity to learn, and learning truly never ceases to exist. To do better every day and to become the best version of myself, to find new ways to improve care is something that is very close to my heart. And so every hardship encountered opens a door for growth. And it's important to not get too comfortable in your niche. As I mentioned, learning is continuous, and the combination of meaningful patient relationships and continuous growth is what keeps me committed year after year. As to how I personally measure success, and I define success by the quality of care I provide and the trust my patients place in me. If my patients feel heard, supported, and confident in their care plan, that's success to me. It's not just about clinical outcomes. It's about building relationships and making sure my patients feel safe and understood. As a leader, I define success by how well I support my team. Leadership to me means creating an environment where others can grow and communicate openly and feel valued. Creating that psychological safety network within my team is very important to me. And if I can help remove barriers, improve workflows, and foster a culture of mutual respect and accountability, then I know that I'm leading effectively. So success is seeing others gain confidence and mastery of a new skill. To me, success is leaving people better than I found them, whether they're patients, team members, or simply curious thinkers.
Noor Ali, thank you so much again for taking time out of your day to talk with us today. We really, really can't say enough about how great this conversation has been.
Thank you so much, Jesse. It's been a pleasure to share my experiences with you.
We want to thank Noor Ali again for sharing her experiences, perspectives, and passions for the PA profession. And thank you for listening to this week's episode of the PA Insights podcast. If you enjoyed this conversation, be sure to subscribe, leave a rating, and share the episode with colleagues or students you might think find it interesting. See you next time.